Now look at this image over here. Imagine that there was a uterine artery and all its branches, and while taking an incision or while delivering the uterus, the wall of this, you see, this wall has been damaged over here. So this is a damaged point over here in the uterine artery. So this was your uterine artery. Basically, this is your internal iliac. It goes into two branches. The one that goes up is your uterine artery, and the one that goes down is your descending cervical artery. So your ascending branch is your uterine, and all these other branches that it gives inside. So there was a damage to the wall of your endometrium. Of course, there are three layers that are present. The outermost is your adventitia, the middle is your media, and the innermost is your intima. So your intima and your media are damaged, and only the adventitia was intact. Now, because the adventitia, that outermost layer, the tough outer layer of that uterine artery, that vessel was intact, hence you didn't immediately see the bleeding during your surgery. But after that, because the tunica media, the muscular layer is gone, there was a small collection, a hematoma that was occurring in the wall of your vessel. So you see this kind of a hematoma that was occurring inside. This hematoma took some time because the adventitious layer was present. It took some time for the blood to trickle out from those layers and start forming a hematoma. And in that 1 or 2 days were gone. But after that, once the hematoma became so huge that it finally just ruptured, as you see in the C image, and that rupture is now coming out as bleeding from the uterus, and this bleeding can of course be torrential because the hematoma has ruptured after a long time of its formation. So there's a lot of blood that has accumulated inside that is going to come out as a trickle, and the trickle is not going to stop. This is called as pseudoaneurysm of uterine artery. The pseudoaneurysm is basically because of a injury that was because of an injury that was sustained during delivery, during surgery, or whatever, but it was not an immediate effect because the injury was not that prolific that it sheared off the adventitious layer as well. Probably there was too much of pulling of the uterus because of the baby delivery being difficult or something, or you used a forceps during cesarean section to deliver. So the adventitious layer was intact, but the inner layers got torn off. This is called as a pseudoaneurysm of the uterine artery, one of the uncommon but definite causes of secondary postpartum PPH.